I think globally the biggest issue related to preventing Rh disease is identifying women at risk and then treating them appropriately using Rh immune globulin immunoprophylaxis. We've done a study where we estimate that half the women in the world who need access to Rh immune globulin don't have access, primarily because of education, awareness, finances, lack of government intervention. And this is mostly in lower middle income countries. So in high income countries, almost all women are typed for Rh status, and if they're Rh negative, they receive Rh immune globulin at the appropriate times, whereas many women in lower middle income countries are never blood typed, never receive Rh immune globulin immunoprophylaxis, and then many of them become sensitized and then eventually can't deliver live children. So I think that's the biggest issue globally. The first thing I would do is thank them because I think they're heroes, and I've met some donors who've been donating for 20, 30, 35 years routinely, which to me is amazing. And their plasma is really life-saving. It's estimated that in the United States, over 10,000 babies are born healthy every year because of Rh immune globulin, which was invented in the 1960s. And their plasma is life-giving. So I thank them for that. I think the plasma protein forum is incredibly important for getting people together in the field and bringing people outside the field into the discussion to share experiences and discuss how to do things even better in the future. I'm a transfusion medicine physician. I've used plasma as plasma, as Rh immune globulin, as IVIG, as all of these things. These are incredibly important and valuable therapeutic entities, and I think getting everyone together and having discussions and learning from each other is incredibly important. I'm very grateful to be here. I think the last thing I'd like to add is that there's a global shortage of Rh immune globulin, which is the topic that I'm most interested in and most involved in. And so the donors we have are wonderful. But if we're going to succeed in protecting women and babies around the world, we're going to need a lot more plasma and a lot more Rh immune globulin. And so I think the challenge is where to find those donors, how to collect the plasma, particularly in lower middle income countries. If we can start collecting plasma there and processing it into Rh immune globulin, that would be great, but there are lots of hurdles to overcome. And we need a lot of help from everyone to be able to do that.